So residency 4 years, 3 years of fellowship, and then I started practicing. So
I'm so
that
jumbled
was
now. So you completed your MBBS in India for about
correct.
5 years. You
4.5.
spent 4.5, yeah, technically.
Yes,
And then you went to the UK, another 4 years in residency,
7 years total.
right? So
Yeah.
that's total 7 years. And another 3.5 years, so 4 years into the United States. Wow.
I told you,
Wow.
Peter Pan. Peter Pan it is. So, yeah.
Wow.
So, but bottom line is, since last 8 years, I'm not taking any new exams. Nowadays, I take different type of exams, but
Sure.
not career exams anymore. Yeah, that's where we are, sir.
Awesome. Um, let's talk a little bit about your career in terms of you have also taught in colleges and then you moved into various hospitals in the United States. So, how did you become a professor in medicine school?
Yeah. So what happens is, it really depends upon two aspects. One aspect is when you start practicing. Now, when you're doing your residency, of course, you're a part of residency program, and then so naturally you're in a teaching hospital, so to speak, and therefore there will be medical students rotating with you as your juniors when you're a resident, and you teach the medical students. So that's simple. But when you start practicing, then it's on you whether there are like you hit a bifurcation basically.
Mhm.
Either you want to continue with academic medicine or you want to do a private practice,
Mhm.
essentially. So I started with academic medicine. So academic medicine is always exciting because I love teaching.
Mhm.
So in the US, I started in Medical University of South Carolina, which is in Charleston,
Yeah.
after my fellowship. And after my brief tenure there, I was an assistant professor then. That's your sort of your starting point.
Yeah.
Then I moved to Detroit in Michigan. And then with the Wayne State Medical School and Detroit Medical Center, I was practicing maternal fetal medicine. And there I had a chance to teach the fellows and the resident doctors and the medical students. So I was lucky enough to train three levels of students in different stages of development. There I did a lot of research actually. We published something like 17, 18 papers within 24 months.
Wow.
And I almost progressed to the next stage, which is the associate professor. Um, but then I had a better job opportunity again in South Carolina, in Charleston. So I moved from there. And now I'm still assistant professor, but with a different medical college
Mhm.
called Mercer Medical School, which is in Georgia, although I live in South Carolina. But it is always fun to teach. And academic medicine keeps you polished as well. Because in private practice, you lose that touch of current evidence, and yeah, you're sort of up to date but not as much as you are in the teaching hospital.
Right.
So yeah.
Now, we all know that there's a lot of AI, new innovation, and robots coming into healthcare and the hospital system as well. How much do you guys need to really update yourself in terms of usage of those instruments or tools? And how hard is it from what you've learned traditionally and now getting into the rat? I wouldn't really call it a rat race, but actually getting into a race where innovation is the epitome and you need to really focus on fast moving things.
Correct. So essentially, the way the system is designed here, that each year when you are practicing, you're supposed to take a competency exam. Basically, it's an objective exam which you are warranted to prove that you are up to date with the evidence. So the system gives you opportunity with like a thick data sets, essentially, with updated practice guidances. It is on you to read them. It is on you to make sure that you understand and make yourself acquainted with that. And then at the end of which, you give an objective examination. If you're not up to date, you're going to fail that exam, and period. Your license doesn't get renewed as
Oh, wow.
that specialist. So, frankly, there is no other option. So, um, that's one aspect of it. The second aspect of it is, like if you remember when we were in school, we have never seen a cell phone before,
Yeah.
and now even our my young nephew, who's like probably 6 years old, is already well versed with an iPad than I am, quite frankly. Uh, so keeping up with technology is obligatory. There is no
Yeah.
choice. And third reason, which is very critical in the US, and it is coming up in India, and as it should again, and I'm very glad it is, it's something called as an accountability of medical system. In other
Hmm.
words, that if there is an X disease, which 15 years ago it was treated in a Y manner,
Hmm.
up to date technique is a Z technique, which yields way better success rates and way less complication.
Hmm.
If I'm still practicing that Y technique and if my patient gets hurt, then here I will be appropriately suffering. In other words, I will be liable financially. My license to practice will be at stake. The hospital will have no obligation to keep me employed, and no hospital is going to hire me being an unsafe doctor, period. So, even from that accountability standard, it is absolutely critical that you are going to protect your patient, because you don't want to be the guy who is deliberately or because of your lethargy and unwillingness is stuck in your ancient ways and you're not helping
Right.
your patient as it should be. So that's the accountability angle. So whichever you look at it, from licensure angle, from accountability angle, from medical legal consequences, absolutely critically essential to be up to date. So these three are common. And then
Hmm.
fourth is knowing myself. I'm really telling you the fact that I love to learn something new. And I never feel bad that, oh, what I thought before is completely not true. And it is helping me in my paramedical studies, which nowadays, since last 5 6 years, I'm developing myself into our ancient history, our ancient scripture, the Sanskrit language, and so on. So I'm learning, and this is like finding myself again.
I'm glad you touched upon that particular point on ancient history and ancient Sanskrit and ancient way of treating patients probably in the past. I really wanted to ask you, I was kind of not too sure, should I not? But then since we were talking about it, um, where do you think are we going forward with allopathy and other pathies that are available? However, where India is going right now is more of Ayurveda and ancient techniques. So, do you have any comments around it? And do you really think that the next 10 years, probably, there will be a big change in the modern way of bringing in Ayurveda to commoners? Because right now, most of the people, it's so custom that it's got to be allopathy and they're going to get treated and they will get, you know, cured faster as compared to Ayurveda.
Yeah, no, great question. So, and again, this is completely my personal opinion,
Yep.
and it is shaped by my way of understanding, and by no means I seeking agreement with your listeners or with yourself and so on. So this, please treat it as my completely, entirely subjective assessment.
Yep.
I must admit that my respect to Ayurveda has grown up so much in last around 10 years or so. And I hate to admit, but I did not respect or thought of seeking more information data on Ayurveda before that,
Hmm.
because I always thought that the Western medicine is the right way of looking at it. And in fact, my father was an Ayurvedic physician before, just like me. He did multiple ways of training. And before he became allopathic doctor, he was Ayurvedic doctor, basically. And when
Hmm.
he used to tell me, frankly, I remember arguing with him endlessly about it, not even having a clue what the heck I was talking about. But still, I was that confident. In the last 10 years or so, eventually realizing that treat Ayurveda is like, for example, you're working on a power saw, for
Hmm.
example. If you work with your bare hands, then you're going to get punctured and you're going to get cut and you're going to get whatnot, accidents. Herbal medicine is not going to help you with that. You need to put on stitches, put on a band-aid, put on a cotton. So that's the allopathic medicine. But if you would have worn your eyeglasses and your gloves to begin with, you would not be in that trouble to
Right.
begin with. That is Ayurveda. So Ayurveda actually compels you to achieve the homeostasis, which in baseline allows you to fight the common disorders, including infections, by the way, in a specific manner.
Hmm.
Now, there are rules to follow. And in past, again, it was my laughing point to my grandmother, for example, when she used that word pathya. And that was like a joke. Oh, she's doing pathya again. But it's sort of finding or doing your sort of limitations. That's pathya. Discipline is the pathya. But
Yeah.
I never thought of Pathya as the way of life, as a disciplined way of life. You breach that Pathya, you break the homeostasis. Simple as that. You eat too spicy food, well, it's going to cause heartburn, whether you like it or not. Um, if you drink too much alcohol, sorry, but the liver is going to get spoiled. Um, as we say, when the God gives pleasure, the pain follows that. So
True.
don't be greedy, So Pathya is the way of life. Be disciplined. Ayurveda teaches that, which is not followed in Western medicine. That's what made me really respectful about that. And my personal opinion is when all branches of medicine are good because end of the day they are helping those who are suffering. Nobody goes
Yeah.
to doctor for entertainment like you go to movies, for example. And as a doctor, I always felt that when a patient comes to me, they are, for some reason, they are forced to come to me, not because they want to see me and talk to me. They are in trouble. They are seeking a relief from that trouble, and my job is to fix that, period, if I can. B, when I treat my patients who are in pain, in despair, illness, whatever it is, they are in their most vulnerable state. They are not in their best of circumstances. Like you and me are talking, we are in a very secured atmosphere. We are interacting with each other, and really, of course, there is some anxiety in my mind doing podcast with you, but because you feel anxious about that. But apart from that, we are in a very controlled setting. I don't feel vulnerable. Neither you feel vulnerable. We are talking as brothers with each other. But imagine we are suffering with pain. You are seeing the doctor. You're not in your best shape.
Yeah.
Half of the time we are not thinking straight. So it's different as a doctor, the way I've started seeing the world in last 10 years. And Ayurveda should be included, in my opinion, because of that, in the first basic training of allopathic school. Because there is so much of cloud there that we need to break that cloud. You need to see that sky beyond that cloud. Because Ayurveda is very mysterious. It's not
Hmm.
easy. It's sad actually that the way our system is designed, that if you are a top earner, then you are going to go to the top medical school.
Right.
And if you want to be the doctor for whatever reasons you're not matching into allopathic school, then homeopathic or Ayurvedic school are becoming your second and third tier of choices. That's fundamentally wrong because Ayurveda is so dense. And I can't bore you with those time limitations, but to give a perspective, it is hard for me even to correctly decipher the first few chapters of Ayurveda, basically, starting from the Triguna and Tridosha. It's mind boggling. It's
Hmm.
mathematically, frankly, impossible. It's really tough. You need good brains to get into that. And I'm not saying those who are Ayurvedic doctors have lesser of a brain or anything like that. But the way you would venture into doing something you want and something is your second choice is always there is a difference. um, this is like getting to marry or the girl you're seeing for the second time because your first affair didn't materialize. So yeah,
Yeah.
sure, your
Yeah.
wife is good, but it's even better if what you dreamt of materializes into your marriage. You know what I mean? So something
Yeah.
like that. But Ayurveda is amazing. Their concept must be inculcated, it must be taught, and you need good people who understand actually what is written in order to teach. But when we will blend these two, I'm telling you, our renaissance, what we are going through right now, will be amazing. Definitely so. And there is no shame. It's a fantastic science. And I don't think any medical student will look down on that the way our generation did, because frankly, we were ignorant.
True.
I blame myself for that ignorance, basically. But now that's not the case. There is internet now. There is no
Yeah.
reason to be.
Yeah.
Yeah.
Going to ask you a naive question from the student's perspective. Going back to the school education, 8, 9, 10, 11, 12, they have been doing probably fantastically good in biology, PCB per se, I would say, and it still exists in terms of the groups that we've had during our days, PCB and PCM. A person who has not really been doing very well in math, this is a very standard question I have to all our experts, especially because I don't know whether it's become a trend or something's gotten into the minds of the students that they just are not interested or they don't like math, but they're extremely good at PCB for that matter. But in order to balance the scores, obviously they will have to go through the route of math. What could be your tricks and tips to motivate them, because they would want to go ahead, probably pursue, if not the main medicine, but paramedicine or some other branches of medicine?
Yeah. So, your question is complex. There is no straight answer, unfortunately. Can I twist your question and give my personal experience with maths, which is actually hilarious. And sometimes I feel sort of ashamed to admit that. But nonetheless, brothers having a talk, what can go wrong, right?
Yeah.
So here's the deal. So I don't know why, but maths scared me. Um, it's not like I was not interested in maths. I was interested in maths, provided I would understand maths. So the reality is, and again, this is a sort of a middle-aged person looking backwards. Mathematics is language of God, basically. Numbers don't lie. Period. You can't make up numbers. Basically, 1 plus 1 is 2, whether you like it or you don't like it. 1 minus 1 becomes 0. That's it. There is no alternative. So maths is scary. Because unlike writing essays or writing statements, you could get away, but in maths you can't. So I was always very respectful and scared of maths. And I started keeping myself away from maths in 11th grade so much that there is used to be, if you remember, there is a prelim exam before the main board exams in the 12th grade. I got something like 34 marks.
You're kidding me.
No, I'm not. Out of 34 marks. This was 8 weeks before, 8 or 10 weeks before your board exams, basically. And when my father saw that number, he was like, forget about getting admission to medical school. You're not even passing 12th grade with those numbers. I mean, this is incredibly silly on your part, naive on your part, that you're securing these numbers. And I never thought about this. I always thought that I just had to barely scrape through the maths because it's like too much. I used to get anxious, scared of maths. But when he explained things to me, and when I talked to some of my seniors, they're like, dude, if you secure this much in PCB, and then there is another lady or another guy with the same marks, but they have better score in maths, then you're done, dude. You're not going to get it. So I'm like, oh my God, I never thought about this. And again, that's your silly 12th grader, who
Hmm.
thinks he knows everything, but he doesn't know anything, frankly. And I'm like, what the heck am I going to do in next 7 to 8 weeks,
Yep.
So it's a very, very fun story. And I mean, you won't believe it. But we came across a guy who was teaching one of my friends. And I don't want to share his name because I think he's a very private person. But
Sure.
he's an incredibly amazing, gifted soul.
Hmm.
And you might recall this when I tell you, please forgive my coughing now. Excuse me. Sorry about that. So he was a pro to use the plants, particularly the money plant,
Hmm.
as the antenna as a radio receiver. Actually,
Okay.
it's amazing. Don't ask me how. It's apparently a very confidential project or whatever it is,
Wow.
but you can actually use the creepers as a radio receiver, particularly in places where you don't want to show that you have big antennas popping out of your complex and whatnot. But he actually was part of that innovative group, and I'm talking about Sachin back 1994. So you can only imagine now. Maybe the grass is the radio receiver nowadays. Who knows? Whatever. And it's a real story. I mean, trust me, I'm not making this up. But anyway, so he moved to Dombivli at that time, and one of our common friend was like his acquaintance. So he told actually my father that, hey, I know this guy, and believe it or not, this guy I'm talking about, he was 23 years old. So he wasn't like, and he was not in IIT or anything. He did, like BSc, I want to say, from Ruparel, and he wasn't interested in doing mundane, high grade engineering studies or anything, because I think he knew way more than a lot of even IIT engineers. He was that damn brilliant, But
Wow.
yeah, amazing guy. So he, my father came to know about him. So Dada took me and went to his place. And they were like, hey, this is my son. I mean, he's pretty good, but I think he's very scared of maths, or he doesn't get it, or that part of brain is lacking in him, whatever it is. But he really needs to have some respectable score in order to be competitive. And he put it literally like that. So he asked me, what's your like percentages in maths? And yeah, I was doing okay with maths till 10th grade, but in 11th grade I sucked. I didn't realize it that I was sucking that badly, and 12th I was like totally gone. So he prepared me for 6 weeks, Sachin, and I give again all credit to him. And deliberately I had left parabola and hyperbola sequences and exam questions, which used to be the last two sections of our 12th grade paper in maths. That was standard. Last two sections were hyperbola, parabola, 14 marks worth. So
Hmm.
my endeavor was to fight for those 86 points basically out of
Wow.
100, and I got 85 out of 86. And um, that was entirely this guy. He taught me maths so well. I can't even express it the way he taught me. And it's not easy to teach when your student is a I mean scared of maths rather than disinterest. And disinterest comes from that anxiety and scare, if you ask
Yeah.
me. But he prepared me and I got 85. If he wouldn't have helped me, there was no way I would have gotten into a medical school. Because I would might have flunked that exam and had to redo everything, and then I'm out of competition, frankly, or would have gotten into some school which was not my choice but was sort of
Right.
forced on me. So very grateful. And again, he came into my life just like Mr. Ravi came in the UK. So he was literally sent by good God. I mean, Sri Hari channeled me to him in a way.
Yeah.
And I was practically rescued,
Right.
which is without grace of God, krupa of God, that can't happen. I mean, there's no way. But such a fun, weird story. I'm still in touch with him, and he's doing actually so well. He has got like 6 and 7 patents of like a big to do with the radio waves and whatever. He doesn't talk much about it because much of
Wow.
his work is as it should be, whatever government confidential or whatever.
Hmm.
And he's a young guy, but he's a multimillionaire as he deserves to be, because it's phenomenal. I mean, it's a true story. I mean, believe it or not. So, my advice to students would be like, math, you can't mess around with math. So, math again follows the principle, like in Ayurveda, you follow discipline. It's a systematic way of learning, but if you learn math, you cannot go wrong. Nobody can give you zero score if you put 2 plus 2 is equal to 4. There is no way anybody can prove you wrong.
Yeah.
Uh, so math is scary. That's why the people interested in medicine think they are not interested in math,
Right.
because math is very precise and disciplined. It's a language of God, basically. Can't mess around with that. Yeah.
I think the takeaway is also to strategize your way you study at home, how you treat your subjects, and obviously the kind of chapters that you're more interested, least interested, hate for that matter at the end of the day, and how do you go about planning toward it. So I like the idea of you were only focusing on those 86 marks,
Yeah.
and that's what was your universe. That's what you were looking forward to.
Yeah,
So,
absolutely.
mhm,
Yeah. That was the paradigm, and you have to play in that paradigm. It's
right.
as either you can keep it simple or you can keep it really complex.
Right. And the last question for the day, the aspirants community of the medicine um, fraternity, what is it that you want them to be prepared with mentally and also in terms of going ahead with their academics?
Yeah. So number one is medicine in India is tough. It's competitive.
Hmm.
So if you want to be a doctor, then, and again, this is not like me standing on a mountaintop and preaching bunch of people here. Everybody is clever enough to do their homework. The bottom line is, if you are a doctor, then you have to be prepared in your mind to work hard and work long. There is no easy dollar in medicine. I mean, it's
Yeah.
not. If you're making easy dollars in medicine, that's not real medicine. That's something else. But it's a long road. Dedication is important. Then again, having that open mind, that my way is not always the highway. You have to be
Yeah.
open for collaborative medicine, continuous medical education. That becomes the part of life as it should. Accountability, if not enforced as in the US from extraneously, it has to come from within if you are in India. um, Never take advantage of people. And again, over a period of years, I firmly believe that although the doctor may be charging money for the patient, if the patient does get well and if he's happy, that blessing and that grace will take you far in life. There
Mhm.
is no more satisfaction than helping somebody through their despair. It's not. I mean, no matter it, howsoever money you make. Of course, you got to make money. You will make money as doctor, because till that time there are people on the earth, they are going to be healthy, and then they are not going to be healthy. So there will always be need of doctors in some shape, form, and caliber. So that one business which typically wouldn't go bust. But it is a business. It's a very pious business. It's an important business. You get money out of it, but you get true blessings out of it. So if somebody is interested, prepare to work hard, prepare to work long. You will get true blessings from people. You will get wealth, and that wealth is not limited to money. I'm talking about wealth in the sense, people who appreciate you, people who recognize you, the society treats you. If you are a good physician, if you're not hurting your patients, then they will elevate you in their minds. So it is very, very important business to perform and do. So it's great if they want to be.
Precisely the reason it's a noble profession, just not a profession, but a noble profession. That you're dealing with the lives of people, right? So
Yeah, very,
great.
very, yeah, very well said.
Interesting. So thank you so much for your time today, for you giving so much of inputs, and likewise a lot of experts who are coming on the podcast and doing that. So appreciate your time. Thank you very much.
No, thank you, Sachin. And I mean, it's a great platform, and it's like, as we say in Marathi, "Khari wata." If
Absolutely.
any difference we can make in a positive note, then why not? I mean, it will be shame not to contribute. So again, thank you for this wonderful opportunity.